Okay, guys. Let's go ahead and go into the Zoom room now where we're kind of getting backed up, but we did want to bring on the Chief Public Health Officer, Chima Mbakwem, and then we'll get to Miss Maria Pangolino of the Guam Election Commission. Hi, Miss Maria. We're going to just get to Chima. Are you on your way to work? Well, just stand by. Sorry. Yes. We wanted to get Chima in to kind of follow up on the weekend activities. And then I know that Chima, we made quite a push Friday morning about who's got to come out and get tested, about who we're looking at. It was customers of Tsubaki Tower from April 14th to 18th, also customers and staff of A Class Lounge from April 7th on. What kind of progress did we make in getting a hold of these people and testing these groups related to these clusters that you told us about on Friday morning? Good morning.
Good morning. We were able to test up to 565 individuals. It was a good turnout. We had 359 people come out on Friday. I was thinking that Saturday would have been better, but we had a lower number of 206. But we're still offering testing today at the Tsubaki Tower, and then tomorrow we're still having our outreach at Tizan for anyone who feels that they need to get them tested. But another interesting fact is that we were able to identify an additional 282 people that are also were part of the contact tracing for the Tsubaki exposure. These were people who came as a group, and one individual actually wrote their name, and then others went in. So we were able to get additional 287 patrons, and we're still reaching out to them to come out to get tested.
Chima, I know on Friday you said that there were 961 patrons of Tsubaki Tower that you were looking at. Where do these
Yeah.
extra 287 come from?
So this, like I explained, when sometimes when people come into the restaurant as a party, they might have kids, so they will just write in as an adult and write like 4 people in the party. So as the case investigators were investigating, they were identifying those individuals and then adding up the numbers. So we were able to identify 282 people more. So we have a total of 1,243 people that are expected to come in to get tested.
And Chima, was that kind of what the majority of the work was from Friday to maybe this point, was going through those sign-in sheets and getting a hold of people who had been at the Subaki Tower or otherwise associated with any of the clusters?
Yes, so like I said, the investigators were actually having secondary interviews with some of the contacts and the index cases, and they've been getting additional information. So as we as we investigate, we get more. I think the explanation here is, the difference between the case investigation and contact tracing. So the case investigators are the ones who do the interviews, and then when they elicit those names, they actually give it to the contact tracers to now make the calls and arrange for testing. So the investigators, with what they've been doing since these cases started, they've been able to add up more numbers to the ones that we already have. But for the other clusters, we've not identified any new contacts. So the contacts remain the same until people come out to identify themselves as being there, and then maybe we didn't catch them in between. But right now, with the effort we're making, we don't have any new contacts for the first cluster that involved the basketball, Easter gathering, and A Lounge.
Chima, so you said you ran about 500 some swabs Friday and Saturday. Have we already got the results from those?
Yes. So we actually have 2 positives that were identified on Friday out of that number, and we're still interviewing them. But like I said, it's a little tricky because these individuals might have been infected after they left the hotel, or the transmission might not have occurred in the hotel. But the more we interview them, the more we'll be able to place time, or maybe figure out with them where the transmission might have occurred, because you're not very sure. But we still try to figure out how we can narrow it down to the point of transmission, so that it will help us in identifying the contacts that are involved.
Were you encouraged at all by the low number of positives in the testing that was done on Friday and Saturday?
Yes, I'm very delighted because first of all, people actually came out to test, and then were able to identify two. That is enough to say that at least that we still have some form of transmission, but it's not as bad as we expect. Considering the initial numbers that were announced, 900 people being exposed, and then you expect to have that fear of a surge. This is a little calming, to know that, and a lot of the patrons, like I said, would have been using their face covering, and then the hotel had engineering controls in place, to reduce transmission. So this numbers actually clearly shows that I think the hotel did something positive in that. Because if you look back at where the high numbers were, these high numbers came out from the families. So it was the private events where people let down their guards is where the infection was actually higher, the transmission was higher. But if you look at the establishment, you find out that some of the establishments had systems in place that was able to reduce transmission. So I think we should also understand that even when we're in our private residences or with close family members, we should also be careful, and still wear our face mask and keep our distance.
Right. What about the A-class lounge? When you talk about the low numbers so far, and that's so far with the Tsubaki testing, right? The A-class lounge, we saw a little more infection. Did that have anything to do with protocols that may or may not have been in place and being used?
No, you also look at the environment. It's a bar. It's open area. People are singing. So I think it's different, and people come in groups in those places. So all those play a role. In transmission. So that's why we always say, if you're not eating, wear your mask. If you're not drinking, wear your mask. But when people walk in, they feel very comfortable. They let go of their mask, and then they have fun. But we're saying it's okay to dine, but when you're eating, you take off your mask. When you're done, you put back your mask on. I think that short interval can actually do a lot. But when you let go completely, then there's a chance for you to transmit if you're infectious.
Chima, can we get an update on the hospitalizations? Because I'm seeing something in there in the comments that has there been anybody who was fully vaccinated hospitalized because of COVID?
Yeah, the hospitalization for the fully vaccinated, I don't have that information. But there are 3 that are still hospitalized, and I don't have their vaccine history. That is what I can look up. But I don't think they were vaccinated, because if they were vaccinated, it would have been noted, because the
Right.
team is very conscious in that, because those are the kind of information that we need to act on. So for now, I can say I don't have that information.
Yeah.
That means
I think, though, Dr. Cabrera had said that if they had received any vaccine, it was just the one shot.
Yeah, so if you're talking about the whole, some of them actually received their first dose, some
Correct.
received their second dose,
Yeah.
and then some were actually completely vaccinated. Yeah.
Yeah.
So I think 7 of the cases were fully vaccinated.
Yeah.
From what Dr. Cabrera presented.
Yeah. And Rosemary writes in here, the understanding is once you have been vaccinated, it should help in keeping you off the ventilator. And again, people may question what was said by the governor in the press conference, that yes, even if you are fully vaccinated, you can still get and give COVID, but the vaccine is supposed to help you from getting seriously ill and hospitalized with the virus.
Yes, that's what it does. That definitely that is what it does. But like what the governor said is, even if you're fully vaccinated, you need to still wear your mask and protect others, because you're fully vaccinated, you can get infected, then you can actually infect the people that are unvaccinated, and then they end up in the hospital and in the ventilators. So it is your responsibility, even if you're fully vaccinated, to please wear your mask, because it is worse, because you're not going to get sick, you're not going to feel sick, but you're going to infect every other person. While we are trying to get up to 80% of the island vaccinated, the ones that are unvaccinated now stand a chance of getting infected and getting into the ICU. So that's why the governor, public health director, the park group, the legislators, everybody's coming out to say, please go get vaccinated, so that we can get to that level of herd immunity, that we can at least feel a little more comfortable. Right now, we are marching towards that, but we need more participation by the community.
I just got a message from Dr. Hoa. No patients in the hospital who are fully vaccinated, and I know we covered that.
Yeah, and I was sure, because that would have been one of the first things they would have let us know.
Correct. Yeah. Chima.
They're good.
So Friday, you had some serious messaging here. Come out, get tested if you were at Tsubaki April 14th to 18th, or A-Class Lounge from April 7th and on, or if you were at this gathering in Jigo with the Tsubaki staff. And I believe you had also said there were a number of people that you couldn't get a hold of as part of the case investigation. That was Friday. What's your message this morning before we let you go?
I think people should, my message remains the same. People should go get vaccinated. People should wear their face covering properly. People should keep their safe distance and completely wash their hands. So I think that is the only way we can continue keeping the island safe. And if you believe you are part of that group, or you would have been exposed to that group, please go to Tsubaki Towers today to get tested, or you can go to the Tizen outreach tomorrow. Public health is urging you to please come out and get tested, so that the island and the community will be comfortable. Thank you.
Thank you, Chima.
Thank you.
Take it easy, my friend. All right, Chima Mbakwem, Acting Chief Public Health Officer, 7:53. Let's keep it going in the Zoom room here.